Welcome, everybody. Thanks for joining us today for our Mask Me Anything live question and answer. I'm Dr. Atul Grover. I'm the Executive Director of the Research and Action Institute at the Association of American Medical Colleges, also known as the AAMC.
And I'm Dr. Ross McKinney, the AAMC's Chief Scientific Officer. We're holding this informal event to try and answer questions about what you should do in terms of wearing a mask, when you should wear it, what to do about masks, what kind of masks work, all those sorts of questions for you.
And since there's not an official national strategy at this point, what we did last week was to release national guidance on face coverings that represent the consensus of leading experts in public health, science, and clinical care. Those recommendations are a follow-up to a roadmap that we released with broader recommendations on July 29th. So I hope that you will get a chance to look at both of those.
So from a scientific and public health perspective, we know the consistent use of face coverings, along with frequent hand washing and practicing social distancing, is one of the most important things that each of us can do to limit the spread of COVID-19 and to keep everyone in our communities more healthy. So today's conversation, we're going to focus on consensus guidelines and guidance about when and where and how to wear a mask. And we know that even people who really want to do everything right may not be able to do as effectively as they'd like. So they want to know what they can do and how to do it best. So that's why we're here, to answer your questions about wearing a mask, and those questions that in fact may be itching the back of your brain.
Yeah, you can actually get to that back with a nice nasal swab if you're really lucky, Ross. So, but if you just have a question you want to pose to us tonight, you can put that in the chat. We've gotten a couple ahead of time as well, and gotten some kind of frequent questions that we've gotten prepped from folks. So we'll try and answer all of those as well as we can. So we've also gotten some from social media. Appreciate people tuning in, and I think in addition to the acknowledgement that we're going to do the best we can in terms of answering your questions. We also know that everybody out there hopefully is trying to do the best they can in terms of keeping their faces covered. And it's hard. It's something new, but appreciate that everybody is tuned in and willing to think about this as a national priority. One of the questions that we actually got was about why mask guidance has changed over time. And that was submitted through AAMC Action. If you're not signed up for that, by the way, I'd encourage you to do that. And the reason is, we don't know a lot about this virus. Certainly, we know more now than we did 7 or 8 months ago, and even than we did 3 months ago. And I'm sure Ross will back me up that science changes on a regular basis. And one of the hallmarks of good science is people's willingness to actually adjust as you go on. So if you think about, everything from the earth is flat to now the earth is round, or thinking about things like giving people aspirin, baby aspirins to prevent heart attacks. We now know we don't do it in everybody. These guidelines change because we get more information. We've learned a lot more about the virus. And Ross, I don't think this is really that different from a lot of other things, but you're just seeing this in real time, right?
Yeah, well, we're seeing how we are learning. We're seeing what the problems were. I mean, early on with masks, we were told to limit the use of masks because, in fact, they were in short supply. Even those cheap surgical masks were in short supply because they were manufactured in Wuhan, China, and the factories were shut down. So we didn't have the masks available that we needed. So originally there were instructions, don't wear masks, and those instructions were clearly in error. But you look back and in context, we understand why those recommendations were made.
Yeah, absolutely. And I think people now, thankfully, are listening to that guidance. And I know a question we just got actually prior to the talk on Twitter and then on the chat here on YouTube was, what about wearing multiple pieces of equipment? So for instance, what if you're wearing a face shield already? What are the benefits, and should you be wearing a face mask as well? So Ross, I'm going to toss that back to you too.
Well, so the combination of face mask protects your eyes, but in fact, it doesn't do such a great job for aerosols. So it's a better idea.
The shield, right? So that's
the shield, right? The shield, the kind of the usually light plastic of some kind, little thing, strip on your head, fastened over your head.
Looks kind of like cool, a skis bar at the salad bar, right?
Right. It's designed to scare people, and but it's a very good thing to have for your dentist, for your dental hygienist, for anybody who works close with people. And in fact, there was a study that looked at people wearing a face shield and a face mask, and there were two hairdressers who were both infected and used that combination and infected not one of more than 100 customers. So the combination is effective for protecting people, and it's probably better protection for yourself to have the combination of the face mask to trap the aerosols, and then the shield, which can protect your eyes if you don't wear glasses or if you're close to people. If you're at 6 foot distance, you probably don't need the face shield in addition to a mask. But if you want to really protect yourself, it's a better idea to have both than just to wear the face shield.
And I think there's a little bit of, sort of fun science piece behind this. Is we know we have that kind of mucous membranes in our mouth and our nose, places where that virus can attach to easily. But in fact, you've got them in the lining of your eyes and other places too. Don't have it on that intact skin. But that's the idea here, is if there's a chance that anything could get in your eyes, we think it's probably less risky. There's less exposure, inch per inch, but that'll give you that additional protection. Again, as Dr. McKinney says, probably not for everybody to need to do. The next question we have is one that I get frequently as well. What's the best material, right? So if I've got a homemade mask, how many layers should it have? Does thickness of the material matter? And because Ross is the chief scientific officer, I'll let you give the scientific explanation. I'll tell you the very common sense explanation I use, which is multiple layers are going to basically block multiple times anything that you've got coming out of your mouth, and some degree, some stuff coming in. So the more layers, the better. Now, there is some diminishing return as to how many layers. You don't need to necessarily have 10 layers, but Ross, what's the science on the sort of the minimum number or that really helps people?
Well, once you get to 2 layers or more, you're really into serious benefit. A single layer, it's better than nothing. And even a bandana is better than nothing. But multiple layers, 2 or 3 layers, and actually a tightly woven poly layer with cotton closer to you is actually a comfortable and effective way to have a mask.
So multiple layers sounds like just about any kind is going to be better than nothing. It's those single layers where there seems to be some question about. The other thing that seems to be very difficult for people, I've got a big face, and I know that if I'm walking around and talking to people, my mask will slip down. And so I've been on the hunt for extra large masks. I've found some, but I do see people walking around, and evidently our friends on Twitter do too, where they're only covering their mouth. And tell me, what kind of protection does it mean? You get half the protection? Is it half for me or half for you? Like, how does that work, Ross?
It's not working for anybody. It's working a little bit, but it's not working enough. And if you have difficulty keeping it to hold up your nose, a mask like this that has a wire on the nose piece actually makes it so it can be really snug and stay in place.
But that doesn't have dogs on it, Ross. So I don't know if I can use that.
But the notion is, you want to keep it because you're exposing mucosal surfaces to aerosols when you're wearing a mask and you're putting it down here. And in fact, if you blow your nose and the mask is in place, you are in fact generating aerosols. So everybody benefits from you wearing a mask correctly, which is over the nose, over the mouth, down to the chin, and as tight as can on your cheeks.
And that is actually harder than it seems for a lot of people. And in fact, again, I get that this is different. This is new. I still feel like I've stepped into sort of some kind of post-apocalyptic movie scene when I walk into the grocery store and everybody's wearing masks. And it's just going to take some time to get used to. But as hard as it is for us, Ross, you're a pediatrician. And one of the things that we've said in the guidance, because it is sort of the standard from the public health agencies, is that everybody 2 and over should be wearing masks. How the heck do I get a mask on a 3-year-old when it's hard enough on a 50-year-old?
Oh, you can train them early. Kids are pretty adaptable. If you start explaining to them, you're going to wear a mask, and this is how you wear a mask. This is what we do when we go outdoors in public. Kids don't have the same set of expectations that adults do. They're more flexible. And so, in fact, it's reasonably easy to teach a kid to wear a mask, and they can get very disciplined about it in a way that adults may not be, because they become.
So is this working with your grandchildren right now?
It is working. My grandkids came over. I have 10, 7, and 7, and all 3 of them arrived with masks when they came over last weekend. So, yep, it's they get it, and
So
it
did
worked.
you hug your grandkids with those masks on, Ross?
I actually hugged my grandkids without the mask because we've all been playing hermit pretty well, and we sort of have accepted that we're in a
The pod.
pod in a
Yeah,
sense.
that's
So we accept the pod.
all right. Circle of trust, right? You're a little bit like De Niro in that way. I know you well. So what about getting, assuming you've got to travel by air, or you choose to travel by air, um, how do the masks work on the airplane? And is it the same recommendations for inside an airplane as it is inside a building?
Yeah, it's the same recommendations inside of a plane. The people that or you should just wear the mask while you're in the plane. There's no difficulty. It doesn't decrease the oxygenation sufficiently that it causes any problem for people in a plane. And I hear all those rumors about, masks being bad for people, causing people problems breathing. How surgeons have been wearing masks for years, and you just don't see them keeling over in the operating room. It doesn't happen. Masks are fine, and it's not a reasonable excuse to not wear a mask.
Yeah, and so it's really important to reiterate that there is no deoxygenation that's going to happen from your wearing a mask. Surgeons do this all day long. Certainly our frontline workers have been out there wearing masks for 15, 16, 18 hours a day. Um, there's no negative effect. And there's really very few things in medicine that, Ross or our colleagues could be recommending that have no side effects. And so this is a pretty clear recommendation. It is, however, as I see we've gotten a question, Ross, it's hard to eat with a mask on. So
Mhm.
if I'm in a restaurant, well, I guess number one, let me ask you, would you go to eat in a restaurant at this point? And if you do, what's the mask behavior that you're trying to follow?
Okay, so there are a couple of things when I think about going to a restaurant. There's no clear, perfect answer. You certainly are going to wear the mask going into your table, and you hope that the staff are wearing masks. If the tables are situated 6 to 10 feet apart so that people are able to retain spacing, then you can go ahead and take the mask off at your table. I've been out to eat once at a restaurant since the epidemic began, and it was outdoors. So all the tables were spaced 6 to 10 feet apart, more like 10 feet apart. The staff all wore masks. You wore a mask when you went to the bathroom. You went to a mask when you walked in and when you left. So, you can do it. It can be safe. And when you're sitting there at the table, it's okay to take the mask off because you've got the distance that makes it safe. And in that particular case, there was enough ventilation. We weren't worried about it. If it's a close, low ceilinged room, that's noisy and people are having to speak loudly, so they are generating aerosols, I don't think that's a good place to go to eat. So you want to go someplace where they can be quiet, where there's no need to have to project, where there's no need for people to be yelling across the table, because that's going to be a situation where aerosols are generated. So if people are not wearing their masks, they're still generating aerosols that might be concerning.
Yeah, and I think, so outside 6 to 10 feet, we sound okay. Inside, one of the things that we see here now, hopefully we can do this well into the fall, at least in places like North Carolina or Washington, D.C., where you and I are, is be able to go and eat indoors at a restaurant where they've kept things apart, have high ceilings, and are also opening windows or other openings to the outside, because that seems to be helpful as well. What about playing sports is a question that we got, and it's, I know we're trying to do our best to adjust to life here. This is going to be with us for a while. We've certainly told people that they need to expect to wear masks for a while when they're interacting with people that aren't part of their household. But at some point, kids are going to have, and even adults are going to want to go and play sports. So what about a sport like soccer, where you've got kids running around? Can they do that safely? Does the mask protect everybody? And in fact, if they're sitting on a bench outside, should they still be wearing the mask?
Well, the answer on sports is you want them to wear a mask, but you still have contact. So, you have to worry that the kids are going to bump against each other and rub against each other. And so when they were not wearing the mask, they probably did things like touch their face, touch their eyes, touch their nose, and then their hands and arms got contaminated. In soccer, you'll be bumping against each other in all likelihood. So it's tricky. Some sports, golf, tennis, not really a concern. But you get into contact sports, including basketball, um, hockey, soccer, you have enough contact that you have to worry, even wearing a mask, that there's some possibility of contagion.
Yeah, and that again, this is all kind of a shift for us, and one of the things that people have asked is because we've talked about washing face coverings, is how often should I be washing them? And I've sort of said, look, it's kind of like your underwear. If you have enough pairs of underwear, ideally you'd want to wear them once and wash them again. Can you adjust that? Sure, but ideally you want to wash that every day. What about the disposable masks? So some of us have these kind of disposable masks. Is there any guidance as far as how long they can be used? Is there any method to clean them for the average household?
So for those paper masks, no, they shouldn't really be clean. There's no way to clean them. How long do they work? It depends on how long you use them for. If you just put them on for 10 minutes and then put it away, you're probably okay. If you wear it, half a day, you're probably getting at the limits. If you were out there in the woods and you put it on twice during a hike, you're probably fine to use it again. So it's really dependent on how much exposure you have to other people and how close it is.
Yeah, and I think that's one of the hard things for most of us to write down every single scenario here. But I love this example, Ross, of if you're in the woods and you're hiking and you really only see somebody once passing them coming in on the trail and you put it on. That's a very different situation than if you're sitting inside and talking to people all day with your mask on. And so people need to bear with us a little bit that there's no absolutes in some of this. The best thing to do is to have that mask with you at all times. And certainly having that mask, even if you used it yesterday, is going to be better than nothing if that's what you're stuck with. But those disposables, you do want to try and refresh on a daily basis or something close to that if it's possible for you. Now, one of the questions that came in was somebody going to visit their 88-year-old parent and saying, look, if I wear a mask, is that safe enough or is it still a risk? I'll let Ross kind of talk about the specific levels here, but the problem is there's always some level of risk here. And part of this is going to be different for every person in terms of thinking about what's the risk to me, right? Am I young, healthy? Am I keeping my distance, controlling that part of, the interaction versus am I older? Do I have multiple chronic conditions? Do I have underlying lung disease or cardiac disease or kidney disease that would make it really problematic should I end up getting infected? So, part of this is an understanding of what each of these sort of relative risks are. And you got to make some of these decisions yourself. But Ross, how does somebody assess that level of risk for an 88-year-old parent or themselves? Like, how do you sort of put that on the spectrum?
Well, that's sort of first you want to know, is that 88-year-old parent in a pretty isolated situation? Are they at home by themselves? Do they have people coming in? Are they in a nursing home? The risks change by the number of exposures a person has. So if you have been staying at home and maybe go to the grocery store once a week or something as limited as that, you probably aren't much of a contagious risk. I would still wear a mask, but you can go visit that 80-year-old, 88-year-old grandparent.
And I assume
Because
that my parent's going to be wearing a mask as well, right?
yeah, you're both wearing masks, and basically you have kept yourself from being in a situation where you're likely to be exposed. So that puts you in a situation where you could go meet. However, most nursing homes these days, because my dad's in a nursing home, nobody gets in
Yeah.
except for staff. It's just not, no matter what the situation is, nobody gets in.
And what about the other question that's come up, and even here locally, there's been kind of varying guidance on what we do when we're exercising outside. I know you said it's safe, like I'm not going to be injuring myself or putting myself at risk for hypoxia if I am running or biking and wearing a mask. But do I really need to do that? I seem to be moving by people really quickly if I'm moving by them at all. Like, do I need to do it?
And the question is the number of people that you're getting close to, and are you getting within that 6 foot radius? If the answer is you are getting within that 6 foot radius, yep, you need to wear a mask because you're generating aerosols. And if you happen to be in that asymptomatic phase, then you could be generating virus around droplets, particularly when you're breathing hard. You would be generating lots of droplets. And so, it's a good idea to wear a mask if you're going to be exercising and you're going to get anywhere close to people. Now, if you're off in the woods completely, you can take the mask off. But if you're like doing the urban jog in the neighborhood that I lived in DC, I would wear a mask because you want to be safe and you want other people around you to
And
be safe.
certainly, I think if you're not, even if you're not planning on wearing a mask the whole time, you don't think you'll run into people. What we've been telling folks is also, we ought to be thinking about this like our phones or whatever it is that you don't leave the house with. Bring a mask with you because you may think you're going to be able to be 6 feet away from people, but you're not always in control of that safe distance. We've got to sort of adjust for everybody else's behavior. Certainly the best thing is if you're both wearing masks, if you come anywhere near each other, but at a minimum, you want to be wearing yours. The other question we got live in the chat here, Ross, was about, should I worry more about this aerosolized exposure that I might get from breathing in or contact? What about touching surfaces? Because even if you're talking about that restaurant where we're eating outside, tables are spaced 6 to 10 feet away, and the wait staff is wearing a mask, what if they're touching stuff back there? Like, is that safe? What's the relative risk?
The risk of virus spread by contact with items, which are called fomites, is really pretty small. Because what has to happen is you have to have a significant amount of virus on whatever that thing is. And then you have to, so if somebody was back, if the chef was coughing away, full florid COVID-19,
No mask
coughing
on,
away,
coughing on your food.
right? No mask on. You don't know. He's got his glass of wine and he's just coughing away. Then you might have a little anxiety, but most of the time people are being relatively cautious. They're wearing masks. They're demonstrably helping protect you. So if they're wearing a mask, the likelihood you're going to get much virus from off of a surface, because it doesn't go through your skin. You have to transfer it from wherever you touch it, from that to your mouth, nose, or eyes for you to become infected. So it's unlikely. And most
And
of us,
there's the other thing that you just said that I don't want people to lose track of is it's your hands, right? If you're washing your hands, maintaining that distance, and wearing a mask, you're in pretty good shape. And even if you're touching these fomites, touching materials that have been touched by others or potentially coughed on by somebody who's infectious, there's no way for it to get into your system through intact skin on your hands. So don't go out and lick your mail when you get it in the mailbox. But in general, this what we were doing a few months ago of sort of trying to spray all the mail with Lysol and everything, probably over the top, right? Given what we know.
was way over the top. I mean, it's yeah, that was not really a concern, and we way exaggerated. The grocery deliveries did not have to sit there for 24 hours while the ice cream melted in order to avoid people getting infected. It just wasn't going to happen.
Yeah, there's no wonder there was no Lysol wipes anywhere left in the Mid-Atlantic after that, because I know we were all kind of wiping down our mail and every Amazon box, or ordering all this stuff. And we probably didn't need to do that. But again, it's just an example of we learn, we get more facts, we find out. The challenge here is that a lot of these things we can't randomize. We can't do these randomized controlled trials. And Ross, you ran these things for years. But I think it's important for the public to understand I can't take 1,000 people and send them out and say, okay, you guys go interact with people and don't wear a mask and let's see what happens. And I'm going to compare with 1,000 that do. It's unethical, right? So I got to wait for those situations like Ross talked about, whether it's those hairdressers in Missouri who in fact, both wore masks and shields, their customers wore masks, 139 of them came through. Even though both the hairdressers were infected, not a single of those 139 were infected out of the ones that were tested. We also know that in somebody who was flying from Hong Kong off the mainland to another country, they developed symptoms while they were on the plane. They were coughing, they wore an N95, they tested 25 people around that patient. No one was positive. So we know that these things are actually pretty effective if we do it. Here's a question that's interesting, Ross. My own doctor doesn't wear a mask unless he's near someone who is sick or vulnerable. And so what do you think of that? And is it true you have to be near someone for 15 minutes and within 6 feet of somebody for this to be contagious? And if that's not true, what do you say to your doctor?
I say to my doctor, don't you pay attention to the medical literature? Because in fact, they should be wearing a mask. I mean, it's pretty much practicing in an office setting. I mean, you're around your colleagues, you're around people are going to walk through the building, are going to walk through the halls. Uh, you've got to be wearing a mask. It's absurd not to.
All right. Well, I agree with that. And we still got a couple questions coming in. We can, Russ, you okay on time or do you have another TV interview to do?
I'm
Right.
fine.
You're okay. All right. So we might go a little bit over. I'm going to read this one that just came in that churches in my community are considering if there are options for risk mitigation in addition to online only services. If an outdoor service was planned, including singing, where non-household members were more than 6 feet apart from each other, should masks still be worn? Ross?
You could probably, here we don't have specific data. You're estimating, but you're using the combination of masks on greater than 6 feet and outdoors. So you have the advantage. Sunlight is actually a great disinfectant for viruses. The UV
But how
light
quickly?
quite quickly.
Okay.
So if it's a sunny day, now if you're a cloudy day and you're under the trees or you're under a canopy and the air is relatively still, you're probably asking for it. Because not everybody's going to have a good quality mask. Somebody's going to be there with a cheap mask that allows when they sing to generate some aerosol.
Yeah,
So,
I
and
would
we know
agree.
singing is not good news.
Singing is not good news. So certainly anybody there who can wear a mask, I would say wear the mask. The risk does drop as you get further away being outside, but it's not no risk. So
Right? You're not zero.
you're not zero. What about two households that agree to be within the circle together, that they're going to quarantine and say creating a learning pod with school age children? Is that a public setting? Do we all still need to wear masks with each other, or how does that really work?
Well, I think you can, in that particular setting, as long as you are able to really maintain the quality of your mask wearing and your lack of exposures, you can do a pod where you're acting like normal, where the kids can play, where they can do the school lessons without a mask on in a home setting. That's okay. You don't need a mask
And the
for that.
big thing, in my experience has been, Ross, as you said, with, your children are in the circle of trust, your grandchildren in the circle of trust, finding another family who you know well enough to be able to say, hey, and it's like asking asking a tough personal question now to have to call a parent and say, are you really not seeing anybody else outside the house? Are we the only ones that are in the pod with you? Those are tough questions, but questions I think you need to ask. Um, One of the questions that's come up in terms of the design of masks is, how do we make this more accessible for people who have hearing impairments, whether they're, employees in healthcare or clinicians or patients coming in? Because we've been told, lip reading is critically important. And this is actually something that's come up from some of the schooling discussions as well, is, how do we mitigate this challenge of people not being able to see the lips or any other nonverbal cues in communication?
Well, I think for the average situation, it's somewhat problematical. You basically have to stay at a distance. If you are going to be routinely working with somebody who is deaf and is a lip reader in order to get communications, there are now masks that are made that are transparent, that seal, but are basically transparent, so you can see the lips and the mouth move. So
And those are just as effective?
those are effective and should be an option in a situation where you really you're pushed. They aren't the routine mask. They're really there for sort of special occasions, and I'm sure they fog up. I haven't seen how they work, but
That would be my assumption. And I think it's one of these things where hopefully, assuming we're going to have to stay in this situation for a while of mask wearing, I do hope we will think about some of those communities that have those special needs, and I'm confident we'll get better at this. We're in the speed round now, Ross. So what about the masks with filters?
masks with filters, don't use them. They're basically an outlet vent. They make it easy to exhale. You just blow the virus right on through.
All right. Public transportation with a mask. Should I be sitting on the subway next to somebody if we're both wearing masks?
I wouldn't be I wouldn't be completely comfortable. You're better off with masks than without masks, but you're better off being spaced further than sitting immediately next to the person.
Again, so relative risk. We know that you can decrease that risk. You are not going to eliminate it. I think that is enough for tonight. But I really want to appreciate the fact that people have come to join us. We're always happy to take other questions if you want to send them to AAMC today. Please do wear a mask out there. It is going to be one of our key defenses against this virus getting completely out of hand and giving our frontline workers, our doctors, our scientists, everybody else a chance to get through this, find us therapeutics, find us vaccines, and hopefully Ross will be back to talk about some of that as our Chief Scientific Officer. Go to AAMC.org for further information. We're posting new stuff under the COVID-19 banner. So we thank you so much for joining us. Please wear those masks. Ross, anything else to add?
Yep. Have a nice evening and remember your mask.
Remember the mask. All right. Thanks, everybody.